is May 12th, 2020, and it just happens to be the birthday of this amazing woman. Let me give you a good picture here. There you go. And that is Florence Nightingale. She was born May 12th, 1820, to Fanny and William Nightingale, who were part of the upper echelon at the time in Europe. And she was named after the city she was born in. She was born in Florence, Italy, and that was just a tradition that her parents had. Wherever their child was born, they were named after that city. So that's how she got her name. And so, as many of you know, Florence Nightingale was such a pioneer in nursing. And when I go through and tell you all of the things that she pioneered in nursing, it's going to sound so much like nursing today. And she really formed our profession from day one. And so she taught us that the physical care and emotional care were very important, and that infection control, quality assurance, quality improvement, the infographics that she started doing to help explain concepts and theories. She was an early investigator for nursing research. She also helped with the physician research as well and the development of that. She began rewriting medical textbooks so that lay persons could understand them and also become nurses. She also started, how should I say it? She also gave the concept of comfort and hope to patients, which is something that her patients really needed. The family that she was from was an upper echelon family. So for her to be caring for these patients from the Crimean War and in very impoverished areas and hospitals was just something that people in her upper echelon just did not do. And she was, her parents were very upset with her for doing this. And they were not proud, they were not happy. They were very offended that she would even consider doing it. So you have to understand that at the time, the hospitals in those days were very rat infested. People didn't go to the hospital unless they didn't have family that could care for them, or if they were extremely poor and couldn't have care at home. So her parents knew that she would be working in these conditions and that the people that she would be working with could be very unscrupulous. And so they were very concerned. They were very concerned for her health and her safety, but at the same time, Florence continued her work, and she continued a lot of it in private, just because she knew that her parents and her family were so against it. And so she kept a lot of it private until she really forged her way through, and then they had a better understanding of it, and then everything was good in the family after that. But what she taught us is everything about nursing today, where we are. We have all of the same concepts that she had back then. I think the only difference today is the cultural component that we have, because we see patients from all over the world and many different cultures, and the background and the beliefs that Florence had, that everyone should be treated equal and given the same humane care, is something that, as nursing has evolved and we've started taking care of more patients from different cultures from ours, we've understood that there needs to be an understanding and compassion, and we need to learn those cultures. So I think that's probably one of the main differences, outside of course, the technology that we have available and that sort of thing. But as far as nursing and the core of itself, I think that's one of the biggest changes. But anyways, so grateful to Florence Nightingale. She's one of my heroes, and I hope you can understand why. Happy birthday, Florence. And if there was one person that I could meet, dead or alive, she is definitely one of the top two and always has been. Happy birthday, Florence. We love you.